the Minister of Health, Dr Aaron Motsoaledi, says the world is on the brink of a breakthrough to having a vaccine to prevent tuberculosis in adults and in adolescents in the next few years. Motsoaledi was addressing stakeholders at the landmark TB vaccine country preparedness workshop in Johannesburg. Now, this is part of ongoing efforts adopted by the World Health Organization to end the global TB epidemic by the year 2035.
For the first time in a century, we are on the brink of a breakthrough. If the clinical trials that are underway succeed, we may have a vaccine that can prevent TB in adults and adolescents within the next few years. That in itself is huge, huge history. And I'm sure the world is waiting in anticipation for that day where we shall be announcing the availability of a vaccine for tuberculosis. Having worked in this sector for a very long time, I know that we had reached a conclusion long ago that the only game changer in the battle against TB is a vaccine, because every other thing has been tried over the years. If we really do get a vaccine, that will be the day of true freedom from slavery for the citizens of the world who have been held hostage by fear, poverty, and despair because of tuberculosis. The slavery of poverty, which is exacerbated by tuberculosis, premature death of young adults, people getting out of jobs simply because they contracted TB. South Africa is not waiting for the world to act. We are preparing intentionally, early, and inclusively. This is the first national workshop dedicated to TB vaccine readiness. We are proud to be among the first countries globally to do this, and we will continue to lead by example.
Professor Norbet Ndjeka, head of National TB Control Program, National Health Department, joins us now to unpack this further. Thank you so much, Prof, for your time. So we understand that South Africa is on the brink of introducing the world's first adult TB vaccine in over a century. In fact, Health Minister Dr Aaron Motsoaledi there saying that a breakthrough TB vaccine for adults and adolescents is near. Perhaps unpack what this all means.
Yeah, thank you so much for inviting me to speak. Indeed, Minister is right. We're looking at a possible vaccine that could be introduced in the next 5 years. And that is really very, very exciting. You would know that globally we get like 10 million people with TB infection every year, and 1.25 million of these people die. So it's really good that a vaccine is on the brink of being found to be effective, and that's very exciting news.
So just help us understand what strides then the National TB program has made so far, just in form of preparedness for this medical and public health breakthrough.
So what we've been doing really is the following. We're working very hard to communicate with our people, because if we really want to get people to access TB testing, access TB services. So we're trying to find TB to end TB. We're strengthening our testing, our linkage to care and retention in care through shortening treatment regimens and various activities. We do have preventive therapy, like the one we call 3HP. So we're doing all these things, but between 2015 and now, we've only reduced TB incidence by 57%. It is good progress, but last year, we had, 56,000 people who died from tuberculosis. Every year we have a big number of people who die, and that is really where the problem is. And we want to decrease mortality for tuberculosis and decrease the number of TB that we get every year in South Africa. And the vaccine is likely to be a game changer. It can give us bigger numbers in terms of decrease on annual basis.
And I want you to expand a little bit about that. Maybe walk us through where we are in the TB vaccine development pipeline. I mean, particularly in relation to clinical trials and what South Africa's role has been in those efforts, if there's any statistics even around that.
Okay, so in terms of TB vaccines, like any drug or any product, you'll have various phases of research, phase 1, phase 2, phase 3. So the vaccine that is moved, there are a lot of vaccines, 8 of them, probably even more, but the one that is really advanced is the M72. But the meeting we've had really was to look at all these vaccines, and we begin to say the M72 has progressed further. We might get it next 4-5 years, is at phase 3 research. And South Africa has contributed in terms of the sites, clinical trial site. Most of the sites are in South Africa. There are a few in other countries like Vietnam, like Malawi, and all that. So there are many countries, but we've contributed the most. And we know that enrollment has been concluded a year in advance. And that's really what gives us a lot of hope, because we see that this is moving fast, and we might get efficacy studies concluded in the next maybe 3-4 years, and then we will have to be ready then to make use of it, because research is good, but we need to now translate whatever is found through research into implementation on the ground.
I want to speak a little bit about manufacturing and logistics as per the minister's utterances. Is South Africa exploring local manufacturing partnerships, regional supply chain solutions, maybe to avoid the bottlenecks we experienced during the COVID-19 vaccine rollout?
Yes, that's really what we've been doing. So during the last 2 days, what we've been doing is to assess our readiness as a country to introduce vaccine. So we went through analysis around issues of supply, financing, where we're going to get the money, what are the policies that need to change, what is needed within the healthcare system itself, because we need to make adjustments, but also with thinking about community acceptance. But critical really has been like, what is the knowledge gap? What do we need to do with the knowledge available and what we are likely to get? And we are also forging collaboration and in the quest to our strategic planning for vaccine introduction. And we had a presentation from some local manufacturers, where the representatives from BioVac, from AfriGen, who presented, and they convinced us that they can do it, they have the capability, but of course, all this will lead to something that will form a country-specific roadmap for effective vaccine adoption and introduction. So the local manufacturing is top in our discussions, but also financing and access issues, community acceptance are also being discussed.
I want to just talk about the long-term impact, Prof, in terms of how successful this vaccine would prove to be, and also in terms of TB preventative treatment, rather. What would that mean for South Africa's overburdened health system and for the country's long-term TB program?
Okay, yeah, this is a very important question. Let me just start by saying that we do have every year, on average, 427 people per 100,000 population that get TB in South Africa, and that translates to 270,000 people getting tuberculosis. Of these people, 56,000 die. That's a big number. Now, if we introduce a vaccine in 2030, an effective one with 50% efficacy, modeling data has shown that we're likely to save 1.6 million new cases of TB between 2030 and 2050. That will bring down the number of people getting TB in South Africa, and really is a good way to end TB, and it will avert 220,000 deaths during the same period. So it is really about reducing transmission, reducing incidence, and bringing death down, and dealing with poverty, because 56% of people with TB in South Africa spend at least 20% of their resources for TB care, and that is also something that is not socially acceptable.
I just want to, as we wrap up, Prof, just very quickly on the G20 visibility, the minister mentioned, that South Africa will be championing TB vaccines at the G20. What concrete support are you expecting from global partners?
So what we've been saying, the delegates have been saying that we have potential as a country to champion this. Number one, we do have world-class researchers. We're conducting world-class research. We have a lot of sites in terms of clinical trials here, but also we have potential to produce the drugs. We're likely to be the big users of the vaccine, not drug, the vaccine, but also we can sell around the world. But one of the things that came up clearly was that we don't want all this to be linked to be dependent on external financing. We need innovative way of funding domestic, but also we want, because this is a global problem, so we want buy-in from the G20 and the African ministers who will be invited by ministers. So everybody should consider this as an issue, so that there will be more money also from various domestic budgets of other countries. But we want to be champions. We want to be one of the early implementers of the new vaccine when it becomes available.
Prof, thank you so much for your time. Really do appreciate it. Professor Norbet Ndjeka, head of a national TB control program at the National Health Department, of course, speaking there following Health Minister Dr Aaron Motsoaledi's utterances, saying that a breakthrough TB vaccine for adults and adolescents is near.